feel like when we start getting around, milliliter and a half or 2 milliliters of oral medications, you're trying to give them equally. I start talking about Macy catheters with the family, and because they do start to aspirate or the medications drool out, and then you're having to wait like 10 minutes, give a little more, 10 more minutes, and it just is not as effective in treating their pain or terminal agitation. So when that starts happening, I really encourage with the Macy catheter, and done quite a few of them now, and all the families have been so happy, and the differences are night and day. People are able to get comfortable and be dry. The taste is awful of these medications, just awful. Another thing to kind of wrap your head around is, here they're right at the end of life, and you're putting all this disgusting medications that are just sitting in their mouths. They're not able to swallow anything to try and wash it out or anything. And those are the things they kind of go out with. So it would be nice if it was just a standard right near the end Macy catheters, so they can stay dry and have a better taste in their mouth. Having the Macy catheters, families are initially hesitant about it. You're gonna stick what, where, and so it's just like having a urinary catheter. Everybody's just kind of taboo about all of it, and I tell them where this one's gonna go, and they're just really hesitant about it. But every single time, once they've seen the benefits and we get those medications in, and they see their loved one is peaceful and sleeping and comfortable and not suffering from pain, they relax so much more. It's no longer a fight trying to get these medications in orally and meds coming out all over, or they're person combative because they can't do the taste anymore. The patient is accepting and so much more comfortable, and the families are just so relieved. And it's, with your instructions that you have, and that I write the meds out on the list, and it's so easy for them to follow, and what meds to crush and how many milliliters of water to add. And it's so simple, so simple. Typically, prior to having the Macy catheter, we'd spend hours of nursing staff out at families' homes, just chasing the symptoms and trying to get them comfortable and staying there one-on-one with folks many hours. And every time I've done a Macy catheter, within 15-20 minutes, they're already comfortable, and then it's just time spent teaching to go over, the medication administration. Nothing compared to before the Macy catheter, and just trying to triage over the phone, and then you go out and do your visit. I'm just a believer in your product, in this product. And, I do remind the nurses that we have it. I also remind the doctors, if I overhear them talking about someone with the pain or agitation, like, hey, some nurses are a little bit apprehensive because they haven't done one yet, but I just talk to them and the benefits and hand them one, and out they go. I am just so grateful to have this product, to be able to offer it to my families and to my patients. And the difference is just night and day. And I will continue to use this and share it with others.